Hello guys, it's Skaie here from Central Coast News. I guess we've made headlines across the nation, I guess the last 24 to 48 hours. Not necessarily the right reasons, but I guess the attention now is going on, I guess, more transparency from the government, and I guess just journalists getting that information now, I guess, is a big thing. I guess the reasoning behind my question originally to John Barilaro, sorry, these masks are really hard to talk in, was the patients were being transferred from Western Sydney Hospital to Gosford Hospital. That wasn't the big concern. I've had reputable reports, CCN has got that, Coast Community News, from people within there that the women's health section has allegedly been shut, and the women of the Central Coast have had their appointments cancelled. I guess this is the biggest concern for me, is our women here, our local Central Coast women. Where are they going? What information has been given? I guess what's the context? And we went to try and get that information, and we've still struggled to get it, so that verification of what's happening. Like, we are a network of state hospitals, I get that, but it's sort of like, well, what's happening in a bigger scheme for our local women, and is there other things been set up for them? So I'm still awaiting the response. I spoke to John again this afternoon, and he's going to chase New South Wales Health for an update, but here's what was said earlier.
They haven't come back with anything on that. Again, as I said yesterday, those arrangements happen often. We know that we are sharing resources, but I haven't got any fixed answer from what was the final decisions of why that arrangement. So again, I can only ask you to just wait until I give you an answer.
Did New South Wales Health say anything about the delay in getting that information concern? Like, what's the hold up?
No, look, I just think this is just ongoing conversations, and therefore they've got nothing to add at this stage. But I'm going to make it a priority. I'll jump on the phone as soon as we get off this today, Skaie, and I'll try and come straight back to you.
Awesome. Thank you. Appreciate it.
Yeah, look, the message is that we know that there's more Pfizer coming online, and I've been advised that GPs are getting double their Pfizer supply. That's what I've been notified about, and that's only good news. That means there are more opportunities for citizens to get a Pfizer shot. They need to go Pfizer. So for everybody, my advice is to, even if you've got a booking in the system, is to keep jumping on the system to see if there's anything else that pops up. I know that happens across the board here in Sydney and other regions where opportunities arise for vaccination. So again, just keep looking at it. As we get closer to the end of September, more Pfizer, and especially into October, there'll be an abundant amount of Pfizer available. So I'm even if you've got a booking in November, I'm confident you can still get something over the next period, because there's more Pfizer coming.
And the reassurance, I guess, obviously you spoke yesterday that those, we're not going to be restricted. You're going to have a look at the region as a whole and out of lockdown and moving forward.
Yeah, absolutely, Skaie. What we've said with the roadmap, it is a state average, but in the meantime, it doesn't mean we're going to let a community fall behind, because even though you've got a 70% state average, that would mean reality, if you know that Sydney's numbers are higher, there are regions that are going to have low numbers. We don't want that scenario, and to be honest, if we can lift the regional numbers up quicker, I think we'll reach the 70% state average faster. There's a benefit to everybody. So there is a benefit why we should refocus and retarget vaccination in regional areas that are below the average. And if we do that, I actually think we'll all come out of the lockdown quicker. And
just lastly, what happens to those that are adamant that they don't want the vaccine? Obviously, are they just going to not have freedoms at all?
At 70%, we're saying if you're vaccinated, you'll be able to go to the pub, you'll be able to go to a club, you'll be able to go to a restaurant, you'll be able to do a few things, or a lot of things that unvaccinated people won't. But we'll have more to say around, how are we going to manage that? Because there is going to be crossover. There are going to be people who go to grocery shopping, and under the current restrictions, unvaccinated people have access to goods and services, essential services. So we'll be able to look at all of that, and the Premier and the government will have more to say as we get closer to the 70% start date.